Welcome to Medicare Connect Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you, whether you're 65 or older, approaching 65, or maybe you're making healthcare decisions for a loved one who's in their golden years. We invite providers and experts to share insights to help you take control of your healthcare decisions. As you get older, your primary care provider is a valuable resource for how your lifestyle choices may need to change as you age. And small changes can have huge benefits. In this episode, our guest is a primary care and sports medicine physician, and we're talking about how to make diet and exercise as you age a lifelong priority. But first, Millennium Physician Group has quickly become the leading independent physician group with more than 800 healthcare providers across Florida and growing. Services do center on primary care, complemented by some specialty care, walk-in centers, radiology and lab services, telehealth, wellness programs, home health, hospital care, and much more. Nationally recognized as a consistently top-rated accountable care organization with consistently high levels of physician engagement, Millennium aims to create a genuinely connected healthcare experience for patients and to be your connection to a healthier life. Learn more at millenniumphysician.com. Your golden years are the perfect time to focus on better health. Getting older doesn't mean you've earned a free pass when it comes to making healthy choices. Millennium Physician Group Family and Sports Medicine Dr. Patrick Murray says the right diet and exercise choices can keep you in shape and out of the hospital. Joining us today is Dr. Patrick Murray from our office in Lutz. Or Lutz, rather. Is it Lutz?
It's Lutz, yeah. It's a confusing name, though.
It is. It's over near Tampa. So, Dr. Murray, thank you so much for joining us today. I really appreciate you taking time out of your day. Give us a little bit of background about you and what took you on your path to family and sports medicine.
Oh, thank you very much for having me. So I grew up in Orlando, Florida, so I'm a Florida native. After that, I hopped around up north for undergraduate and graduate school, but I really always enjoyed sports. I played a lot of different sports as a kid: volleyball, wrestling, basketball, injured myself many different ways. And so after a few broken bones and a couple other dislocations, I was very interested always in injuries. I found medicine, especially family medicine, interesting because that's kind of the first point in contact for most people with a doctor. And I feel in certain ways with preventive medicine, you can make the most impact, even if it's not always visible, like a surgical scar or an injection. And so that's how I kind of found an interest in family medicine. And then obviously lots of people come to a family doctor first about whether or not it's a certain ache or a pain. And so as I went through my training in medicine, I really got excited about sports medicine and non-operative orthopedics.
Yeah, and we're going to talk a lot about that too during the show. But, welcome to Millennium. And I'm really excited to talk to you today because this topic, age, as we age and I know my mom's 72 and she's like, yeah, I don't need to go for walks. I don't really need to do this. I'm 72. I'm fine. I'm super healthy. But, I'm on the other end of the spectrum. I'm like, you know what? I'm in my 50s, young 50s. I want to be active. I want to be able to play with my grandkids eventually on the floor. So is age just a number and a feeling? What is your opinion on that?
So that's a good question. Obviously, it's changing a lot nowadays, but age does have some impact. However, does that mean that you need to just hang it up, sit on the couch for the rest of your life once you hit 65 and you're like, I'm done with work, I don't need to do any of that stuff? No, I think it's still a good idea to be active. Whatever way motivates you to be active is the best way to do it.
Yeah, I agree. And we're going to talk about activity and everything too, but let's start then with something that we all need, regardless of exercise, but we all need nutrition. And there are so many bad choices out there. Like, why does good food have to be bad for us? But can a good diet keep us out of the hospital, keep us healthy?
Absolutely. So a good diet and a well-balanced diet is going to be instrumental in keeping you healthy and avoiding major diseases, things that I commonly see like high blood pressure, diabetes, high cholesterol. And those things, unfortunately, in and of themselves can cause problems, but they can lead to other more serious things like heart attack, stroke, heart failure, kidney disease, and stuff. So really monitoring the food you put on your plate is one of the best things you can do for yourself. And there's lots of different literature out there with regards to weight loss. And I talk to patients a lot about weight loss, and the majority of weight loss is actually done through the choices you put in front of you every day. Not so much that you went and ran a marathon, but more so, what did you eat each morning, lunch, and dinner?
Yeah. And I think that's an extremely valid point because I have always heard, and I've always been that person that's struggled with weight and then through menopause and even perimenopause and everything as you age, right? 80% nutrition, 20% exercise and movement?
Yeah, I've heard 70-30 from the literature I read, but it's
Okay.
pretty overwhelming. The diet is like the really major contributor to controlling weight. And then on top of weight, keeping everything else healthy is the best thing. So monitoring that. So certain percentages of your plate you want directed towards certain parts of the food groups and nutrients.
Yeah. So what does a healthy plate look like these days? The pyramid used to have all the
Mhm.
grains and, the pyramid. I've heard recently is the pyramid, has it flipped?
Somewhat. So it used to be, your big staple was your breads, your grains, your pastas, and rices. Unfortunately, as rising diabetes, rising obesity have come up, we've kind of rethought that to a degree and looked at minimizing the carbohydrates. It used to be like over 60% of your diet was going to be carbohydrate based. Now we're trying to get closer to about 45-50%, increasing from there the percentages of protein and fat in your diet. So with fats also, that's not just, fried foods and ice cream and cheese. It's healthier choices, your olive oils as opposed to butters, additionally more yogurts and things like that. And then from there, your proteins, your lean meats and things like that to get your proteins.
And then important nutrients, like fruits and vegetables, there's a big misconception that fruit is just sugar, but is it a good sugar versus a bad sugar?
Yeah. So for certain patients, if you're a diabetic, you may have to watch more closely with the certain sugar you get from fruits. However, the majority of the time, the fruits give way more than just any type of like sucrose. It's going to also provide you with valuable vitamins and other nutrients you're going to need in your body. So it's a good idea to incorporate that, not to mention the fiber people need in their diet. Just as people age, people's bowels tend to slow down a little bit and constipation becomes a more common complaint. Well, fruits and vegetables are some of the easiest ways to help control that.
Yeah. And, in addition to like a probiotic or something, maybe, or can we get it all through our food?
Ideally, recommendations are that if you don't need a multivitamin, you don't have to take it if you have a well-balanced diet. Now, obviously, if there's certain nutritional deficiencies, whether or not because of certain chronic conditions you have, let's say someone has celiac disease, so they just don't absorb certain things, or Crohn's disease, and then they have a chronic diarrhea issue, they may have to take certain vitamins or supplements to keep up with that. Vitamin D is another one that's an issue for some people just because sun exposure is kind of a risky thing for people who are pale like myself. So they may need to do those kinds of things. But overall, if you can keep it as a balanced diet, you typically don't need that multivitamin.
Yeah, I was surprised when I did some blood work and it came back that my vitamin D was low. I was like, gosh, I soak up the sun for a good 20
Mhm.
minutes a day. I have my sunscreen on, but now I take a supplement at night before I go to bed, along with magnesium, just to help keep that level up.
Mm-hmm. And vitamin D is implicated in lots of different things. Obviously, we know bone health for sure and calcium. It also seems to have important aspects into immune system function, and it's interwoven into lots of different parts of our body. So making sure you have a healthy vitamin D level is definitely important, not only now, but as you age for sure.
Well, Dr. Murray, how do you get patients to make a change? Some folks are completely resistant, and some, I'm sure, some of your patients are more open. How do you make it a gradual change? Do you add water to their diet? How do you work with the servings to really help increase their health?
Gotcha. So first step I try to get with patients is awareness. So sometimes it'll be an app on their phone that just journals the calories they take in. So there's a couple different ones out there and you can find them all. And the goal is basically if you can catalog your basic foods you can get from the grocery store that typically have a barcode with them, or foods you get from a restaurant that you go to that are common. A lot of times you can really find out with that diary over even just 2 or 3 weeks, you can find out, oh my gosh, I should not have been eating that. Like, why am I eating Pop Tarts in the morning and stuff that's way more calories than I need? There's tons of sugar in there. And you can also input your body weight, your age, and things like that. And you can find out, like, oh, that's like 60% of my total fat in the day I'm putting towards that one meal. And
Right.
so once that person gets awareness, now it starts being like, where can we make those changes? So some people really gotta, they have certain things they gotta have every day. Most people gotta have coffee every day. If we can make some changes on, decreasing the amount of sodas you drink every day, that's a huge step. Placing that with water is a long-term thing, but sometimes I say is a small habits you can keep as opposed to big dramatic changes typically are going to be things you're going to stick with longer.
Yeah, I used the Weight Watchers app for a
Mhm.
while, post COVID, and I found that it some of the foods that I really, like you just said, like I really enjoyed eating a whole avocado. Well, as good as it could be for me, it was not good for my diet at the time. So, I had to learn avocado in moderation, and making those gradual changes. But, I'm definitely more of a creamer with my coffee, coffee with my creamer drinker rather than, I'm like, oh, I got to cut back on the creamer. But all of that makes sense. And, a little does go a long way at times too. And, overall health, and especially as we age, it's important to be mindful of that, I'm sure.
Absolutely. Yeah. I think it's always good to just be aware. And then other things to know is as people age, typically the amount of calories you needed, when you're 30 or 40 are not the same. Typically after 50 years old, after each decade, they go down the requirements of calories per day, just as your metabolism changes and slows down a little bit. So you don't have to eat what you thought you used to eat in your 20s and 30s.
Yeah, the body's not absorbing it quite as well anymore.
No.
Well, all right, Dr. Murray, coming up next, we're going to continue our conversation about aging well. And Dr. Murray is going to continue with us too. Next up, we're going to talk about that movement and physical activity part. Medicare Connect Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Medicare Connect Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you if you're 65 or older, approaching 65, or maybe you're making the healthcare decisions for a loved one who's in their golden years. We invite providers and experts to share insights to help you take control of your healthcare decisions. Well, as you get older, your primary care provider is a valuable resource for how your lifestyle choices may need to change as you age, and small changes can have huge benefits. In this episode, our guest is a primary care and sports medicine physician, and we're talking about how to make diet and exercise as you age a lifelong priority. Your golden years are the perfect time to focus on better health, by the way. Getting older doesn't mean you've earned a free pass, though, when it comes to making healthy choices. Millennium Physician Group Family and Sports Medicine, Dr. Patrick Murray, is our guest today, and we have been talking about nutrition, and now let's talk about the importance of movement. Okay, being sedentary, we know doesn't work for the body or the mind, or the soul or the spirit. Maybe a lot of people have different views on that, but let's talk about the importance of movement, Dr. Murray. And as we age, why do we have to keep moving?
Well, it's a good question. I'm always a huge fan of it. But when we look at the literature for, and I know this can be a stigmatized word for some people as they get older, exercise, movement, activity, however you want to call it. There are numerous benefits. As we get older, our blood pressure can go up, our muscles get stiffer, our bones get a little more brittle. Sometimes it's hard for us to keep our memory and keep a little sharp. Exercise helps with all those different things. The body naturally wants to be active, and it helps not only flush out toxins within the bloodstream, it also is beneficial to keeping your bones stronger, keeping your muscles stronger, keeping you more limber, keeping your mind sharper. There's been documented evidence that exercise does help prevent dementia in certain aspects, and it's also a good treatment for things like depression. So it's not only good for the body, it's also good for the mind to help with exercise and stay moving.
Yeah, and a lot of talk about mental health right now, and how can we help ourselves, especially as, a lot of patients that we see are caregivers, so how does a caregiver care for their loved one if they're not caring for themselves? And that movement and of course the diet that we talked about too, both very important. So a little bit about what you talked about. I find it so interesting that movement helps with keeping the mind going. How does that work?
There's certain aspects of improvement in serotonin levels, which are typically decreased when they found with regards to depression and anxiety. And if people take certain medications like the antidepressants, the common ones like your Prozacs, your Zolofts, things like that, those typically their job is over a couple of weeks to slowly increase those levels. Well, the exercise does that as well, as long as it clears out other toxins within the brain. So that pulsing of blood flow by being active is beneficial, not only to the mood, and the body kind of reinforces that by also releasing those other hormones in the body to say, oh, that was good, let's keep doing that.
And what do you tell a patient that just doesn't get a lot of movement in their day? I mean, how do you say, you know what, maybe you start by taking a short walk around the block?
So the easiest motivation is to find out if there's anybody else that lives with them that wants to be active. So that starts not only with like grandkids or family members, friends, but also pets. So if they have dogs, they need to walk. So yeah, I know you take them to the front yard. Why don't we go a little bit farther down the block? Then from there, if they found that they're more comfortable, with just those first few walks, or parking maybe farther away in a parking lot to getting somewhere. Then if you do those things, you start doing it more frequently. So the key is start with something that you can build on, that you feel find comfortable and not necessarily overwhelming. And then from there, you just do it more frequently. Once you can do it consistently, then you can make it more strenuous.
Mm-hmm. And, there's rumors, or, there's talk of, once you do something for a certain amount of time, it becomes a habit.
Mhm.
And people like habits. And if you can schedule it even into your day, does that help people continue with movement?
Yeah, absolutely. If some people can find that. I've often heard the joke that retirement is a full-time job. So if you can squeeze it into your time with the golf course and everything else, it's extremely reasonable to like find that time for yourself or with a group, whichever you prefer, to get out there, stay active. Does it have to be outside? Not necessarily. However, it's easier for some people, especially in COVID, not wanting to risk going into a gym. However, if they want to do things like they have access to a pool, bicycles, or walking, whichever one really gets them moving and happy, I say
Mhm.
absolutely get started with that.
Yeah, because what I like, my mom might not like.
Mhm.
I like to go to yoga. Mom has zero interest in, I would never recommend that she go to a yoga class, but maybe walk around the block, or, you're right, parking a little further away at the grocery store, might be good ways to kind of nudge a little bit more. If I
Mhm.
like it, doesn't necessarily mean she's gonna like it. I always tell my husband too, I'm like, come with me to yoga. He's like, I don't like yoga. I'm like, but it's good for you.
I myself was a little distrustful of yoga at an earlier time with my wife, but I went a little bit later on and found that it is helpful.
There you go. See, and I can't meditate though to save my life. I try. I like really want to shut it down. I really just want to sit there and meditate, and I just can't. I just can't do it, doctor. I gotta get better at that. So, what are some of the recommendations as we age for movement?
Gotcha. Um, so for one, we split it up into two basic types of movement. One is weight-based and one is more for heart health. So for heart health, if you can get what we consider moderate exercise or moderate activity, and we consider that is, if you want to get real fancy, you can wear a watch that checks your heart rate and you can monitor that. However, if you don't want to do that, if you get to a moderate amount of exercise where you're having a hard time finishing full sentences talking to people, but you can still have a conversation while you do it, whether walking, cycling, swimming, things like that, or just on a treadmill, that's fine. Doing that a half hour, 5 times a week, up to basically 150 minutes in a week, we consider that great. If you want to go a little bit more intense and you feel comfortable with that, 75 minutes of intense stuff, that's more of the huffing and puffing. I'm not really talking to anybody. I'm really focused on working out right now. For the weight-based exercises, and this doesn't have to be going at the gym and competing against Arnold Schwarzenegger. This is more of the maybe doing a little bit of just light free weights at home, or some squats or other activities at home, push-ups, sit-ups, things like that. Doing that twice a week at least for like 20 to 30 minutes is helpful, not only just in general for your body, but also for your bone health.
Yeah. And, how does all this work with, keeping our balance? You hear a lot about falls
Mhm.
and really just being unbalanced. My grandmother, I think, is made of steel. I mean, the woman is 95 and she's fallen a couple of times, but she kind of bounces right back up. And, how important as we age is retaining that balance.
Absolutely. So unfortunately, we found certain things like hip fractures can be really devastating to a person, not only for their ability to move around and ambulate, but also mentally it can be devastating. And then further other medical complications can come from that. So staying active and avoiding falls is one of the best things you can do. Building up that muscle memory by continuing to move helps. If you watch your toddlers and little ones as they're trying to walk, they're going to have bumps and bruises, but the key is they keep going, they keep trying, they keep moving and stuff. And sometimes you can do that with home training and home practice. Sometimes you need some help with physical therapists to kind of guide you safely and make sure that you're able to rebound and get up the stairs and do things comfortably and make sure you're not putting yourself at risk for big tumbles.
Yeah. And at what point do you feel like a cane or a walker is important for that aging senior?
Gotcha. So, depending on their situation, so canes typically, if it's maybe one-sided symptoms, so let's say they have bad knee arthritis on one side of the body, then you can use that cane to kind of offload some of that weight, and then they can still keep moving around and keep staying active. If we get other issues that are more bilateral, We get back issues sometimes that are really limiting, or they have other like heart, lung conditions that really limit their capacity to keep going aerobically. That's when maybe the walker with a seat might be more usable for them. Whereas the cane at that point, they might still be fatigued and not be able to use it correctly.
Yeah, I understand. That makes sense. Is there a certain time or a certain age when stretching doesn't, you just can't stretch anymore, or is stretching something you can do forever?
So you can always try stretching. Maybe you won't be as limber as you used to be. However, it's still a good idea because the ligaments in your body, we do know, get stiffer as you get older. So does that mean necessarily everyone's going to touch their toes when they're 80? No, but they still need to be able to move around because that flexibility does help not only the ligaments, but it also improves your muscle function. Your muscles are kind of pretty sophisticated rubber bands. They need a little bit of stretch in them to be able to like snap back and work correctly.
And now this is purely just for me asking, is if you have good balance, are you flexible, or or vice versa? Because, and I'll tell you, I am extremely flexible, but my balance isn't the best in the world.
I would say they're not necessarily put together all the time. They can be exclusive things.
Okay. That's a total
I
selfish
myself,
question.
yeah, it's a difficult one, but yeah. So from my own experience, I've seen some people that are pretty flexible, but unfortunately will still run into things and still take a trip here or there.
Yeah. Yeah. Okay. All right. Well, we are going to continue our conversation about aging well with Dr. Murray. Up next, we're going to talk a little bit about sleep and the importance of sleep and the importance of stress control. So stick around. Medicare Connect Radio, sponsored by Millennium Physician Group, will be right back. Welcome to Medicare Connect Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Every week, we're talking about the healthcare issues that are important to you, especially if you're 65 or older, approaching 65, or maybe you're making healthcare decisions for a loved one who's in their golden years. We're inviting providers and experts to share insights to help you take control of your healthcare decisions. As you get older, your primary care provider is a valuable resource for how your lifestyle choices may need to change as you age, and small changes can have huge benefits. In this episode, our guest is a primary care and sports medicine physician, and we're talking about how to make diet and exercise as you age a lifelong priority. Well, getting older, the perfect time maybe to focus on better health. It doesn't mean, though, that you've earned a free pass when it comes to making healthy choices. Millennium Physician Group Family and Sports Medicine Dr. Patrick Murray says the right diet and exercise choices can help keep you in shape and out of the hospital. And Dr. Murray, we've talked a lot about that today. We talked about nutrition, we've talked about movement, but one thing that I think we're really needing to talk about is sleep. And as I've aged, I've definitely noticed that my sleep patterns have gotten much worse.
Yes. So unfortunately, as we age, there are lots of different changes that happen. One of them is we're going to typically awaken more frequently. We're not always going to be in quite as deep sleep as frequently. And then sometimes our sleep patterns change where obviously depending on our energy level from the day or activities, we may typically go to bed earlier and then we end up waking up earlier, and we're really frustrated with that.
It is very true. And as a menopausal woman, the heat flashes are real, and even with temperature control, I multiple blankets, multiple not blankets, air conditioning on, off, that is extremely disturbing. And I know both men and women go through, the need to go to the bathroom overnight. So how do we, as we age, get good sleep?
Gotcha. So it's absolutely true. You bring up excellent points. So it's not only just the natural changes from sleep, but it's also other things that we develop as we get older and stuff. So other medical conditions can make it so we don't sleep as well. Additionally, medications that we take to help with our other conditions can make it so we go urinate more frequently. We wake up feeling hotter more often. We're waking up just more frequently just because the medication itself makes us jittery. So it's hard necessarily in those respects to always control those things. What we can control is kind of our attitude with sleep. So the attitude with sleep is overall, it's not something to be fearful of if we miss out on some sleep. The goal long term is sleep is always a good idea, but it's not going to be perfect all the time. Nowadays, we look at many different things. They've looked at many different medications, and some of the best things they recommend are what's called cognitive behavioral therapy for insomnia.
Okay.
So what goes into cognitive behavioral therapy of insomnia is one, rethinking the way that we tackle sleep. So everybody assumes sleep is this finite thing that if we don't get it, we're never going to get it back. It's always gone forever and we're doomed if we don't sleep enough. And obviously, yeah, if you don't sleep long enough in a couple of days, you're going to be miserable.
Mhm.
However, at some point you will end up sleeping. The goal is getting healthy habits and patterns to make sure you can do that sleep effectively and efficiently over time.
Okay. So, when they say, oh, you must get 6 to 8 hours of sleep a night, it's the pressure. It's just so much. I don't get that.
It's very hard when people are really busy with work, families, and things like that, that they're trying to juggle so many different things and other medical issues, maybe, to really feel like I can squeeze that in with everything else going on. The goal, of course, is always to get between 6 to 8 hours of sleep. However, that's a goal that's not always something that is going to happen every single night. The goal for me is to let people know and encourage them, like, work on building healthy habits, things like avoiding screens right before bedtime, because that can stimulate your mind to stay awake longer. Additionally, avoiding caffeine and certain foods before going to bed. If you have heartburn issues, if you eat too much spicy food, citrus-based things, fried foods and stuff, and then you go to bed within 2 hours, that might trigger some heartburn flares. Now you're awake, now you're more frustrated. Additionally, watching out for other things like arthritis issues and stuff and trying to accommodate your body so you're ready for that. So doing those kinds of things, and then making the bed and bedroom kind of focused on sleep as opposed to a place where all sorts of activities happen. Because in certain ways, you kind of retrain your brain, almost like you would treat your dog, train your puppy to urinate outside, not in the house.
I like that one. Yeah, that's nice. I like that. Some people think that, like, my husband, for some reason always gets a glass of chocolate milk before bed. I don't know why he does, but for me, I like the one that you said about the screen time. I make sure I put my phone down. I read a real book with real words that I get from the library, because I feel like it definitely helps my eyes settle down. But I feel that as I've aged, with my sleep getting worse, even when I had young kids, I felt like I slept better. So as we age, do you think it's harder to turn off the mind too?
Absolutely. Stress is very real, even depending on where you are in your stage of life. There's going to be something to stress about. And so finding ways to kind of take that out of your sleep cycle, because most people, when they come to me, they're always like, I don't know why, but I suddenly can't sleep and all these other things. I'm like, well, this is the first time when you're not busy with everything else, you have to be there with your thoughts about what's going on in the day, whether it's things going on in family life, work life, stresses medically, things like that. Those things finally come to a head because you're not there to talk to anybody else or do anything else. And so the key is letting some of those things kind of take a little break if you can, either processing them by writing them in a journal before you go to bed, reading a book to distract yourself a little bit, finding meditation techniques, things like that, finding those ways to kind of build up a good habit so your sleep isn't affected by everything else going on in your life. Because it's really hard to tackle your day when you already wake up exhausted.
Right. I have a hard time shutting down kind of the work dreams sometimes, but what about melatonin? Is that something that patients come to you looking and with questions about?
So melatonin is a reasonable one that people ask about. There's definitely, melatonin is a major circuit within your brain to help stimulate sleep. Melatonin also goes into the whole TV screen aspect of the body, where your body is, we're what we call diurnal animals. So we're supposed to be active during the day, sleep at nighttime. What the blue light within screens does is it tells our body the sun's still out. You can still go and do things. The hard part is that doesn't always work. With melatonin, you help kind of remind your body, hey, it's nighttime, it's time to go to bed, the moon's out, sun's down, let's go and get bed and get sleepy. Typically, you can try any of the over-the-counter ones. There is a prescription melatonin that can be prescribed for certain patients. Sometimes it requires certain extra paperwork on my standpoint, but I'm totally fine with trying that out with people because I think it's a fairly safe and healthy medication to try people on.
Are you seeing more patients with sleep apnea issues lately because of COVID maybe, or just not being able to breathe as well as we used to?
Typically, yes, I see a lot of patients as they get a little bit older. And on top of that, as patients are now at home more often, they're paying attention more to their sleep. Some people used to travel for business all the time. Nobody really noticed. Now that they're home with their spouses, they're getting elbowed all night. And so then they come to me after they've been snoring and gasping for air for a while, or they get newfound blood pressure at a fairly young age. So, sometimes, not to point fingers, but sometimes men typically in their 40s or 50s maybe they've gained a little weight as they've gotten older. All of a sudden their neck size and their shirt gets a little bigger, and now they're not sleeping as well. And on top of that, they're having problems with blood pressure issues or cholesterol issues that they never had before. So I have a talk with them, and we try to see if they're ready to do something like a sleep test and find out. And if they do have sleep apnea, there's great there's machines out there that can help people with that.
Yeah. That I was about to say, have you met my husband? Because you just kind of described him right there. So poor man. I actually had to elbow him last night too, because he is sick, and it's just a lot.
It's really hard.
It's really, really hard. All right. Well, Dr. Murray, we are going to continue our conversation in the next segment. We're going to talk a little bit more about your sports medicine side of what you do, and talk about our aging and aching bones and arthritis. So definitely stick around. Medicare Connect Radio, sponsored by Millennium Physician Group. We'll be right back. Well, welcome back to Medicare Connect Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you, especially if you're 65 or older, maybe approaching 65, or you're just making healthcare decisions for a loved one in their golden years. We invite providers and experts to share insights to help you take control of your healthcare decisions. As you get older, your primary care provider is a valuable resource on how your lifestyle choices may need to change as you age. Some changes can have big benefits. In this episode, our guest is Millennium Physician Group Family and Sports Medicine, Dr. Patrick Murray from our office in Lutz. Gosh, I can't get it right. It's near Tampa. I know that. It's like right where 75 and 275 kind of like
just north of Tampa.
Right? All right, there you go. Well, Dr. Murray, thank you for being our guest today. And we've had some great conversation about nutrition as we age, movement as we age, sleep, and de-stressing a little bit. But let's talk about the sports medicine side of what you do right now. And a lot of what you do is non-operative orthopedics or sports medicine. Let's define that first.
Gotcha. Great question. And thank you so much again for having me. So non-operative orthopedics is a very, very long-winded way of saying I help people with their joint pains as long as I don't have a knife in front of me.
Okay.
So whether that involves counseling people on safe medications, braces, physical therapy, exercises, home exercise programs, injections to try to help them get back to where they want to be and feeling better.
Okay. So during COVID, I overdid my knee and overused it. I was riding a Peloton every day. I was doing a walking challenge. I got on a treadmill one day and I heard that awful pop. And I was like, it's the pop everyone's talking about. And oh my God, I was in so much pain. So I went and saw an orthopedic surgeon and he gave me a laundry list of options. And I said, just go in and fix it. And he did. It was a meniscus tear. And it was, he had to do it 17 minutes. It took him to shave or do whatever he did. And
sorry about that.
Yeah. And I have two really tiny little incisions from that. But before getting to that part, how do we manage the pain, especially in women? I know have a harder time going to see a doctor about the pain because they're so busy too.
Women typically are pretty busy. On top of that, women have already been through certain painful activities that don't seem as bad as maybe a meniscus tear. Childbirth tends to be a pretty difficult thing. So most women are willing to be like, well, I got through that, so why do I need to see anybody for this?
Right.
So most people, and if we start with even like knee pains and things like that, if we're trying to find ways to help that person get back healthy. So number one, things like ice, rest, bracing sometimes, depending on the injury to the knee, can help really keep it under control. From there, if we need any anti-inflammatories or Tylenol to kind of keep the pain and inflammation under control. If those things aren't doing it, then next thing we also do is injection therapy. So this is first corticosteroids. Those are kind of a more concentrated amount of inflammatory control to try to get that down in the body and the knee. Then if that's not working, there's other injections available and there's a whole litany. But the big thing outside of all those things is rehabilitation and like physical therapy. So doing exercises to strengthen the muscles around that joint to help keep less of the stress in the joint has been found to be extremely helpful. So in your case, yours is slightly more traumatic in cases of, let's say, somebody who's in their late 60s and they have a meniscus tear just from twisting their knee real quickly, not even doing anything like active. We call those, quote, degenerative meniscus tears. Unfortunately, probably a large amount of wear and tear and arthritis that developed in the knee that now actually gets torn just because of the nature of everything breaking down over time. When they looked at some studies in orthopedic journals, they actually found that in 2 years, if they just did surgery to fix the meniscus, or they put the person through rehab, medications, injections, they found that both patients were at the exact same spot in pain and function at 2 years. So then the question is does that person need to go through surgery? Well, some people may be adamant, and some people may say, you know what, I'd rather not go under the knife and avoid the anesthesia and infection risk and things like that. And so I always bring that up as an option for people. I'm like, if you
Yeah,
want to absolutely
absolutely.
talk to the orthopedic surgeon, sure. But if you want to try these other things, we may end up in the same spot.
I think that is a really interesting way to put it. I was hard no on everything else. I just was like, let's fix this. I'm done. But you had a great point with the physical therapy, because I went meticulously. I went 3 days a week. I was dead set on getting well and back into yoga. And I wanted to do a stand-up paddle thing. But you're right. They worked. I was like, we got to work on the knee. We got to strengthen the knee. And she's like, actually, let's work on the quad and the hip and everything that connected to the knee. And I was like, okay, that totally makes sense. It was like a light bulb moment.
No, it's real surprising. I've been through my own physical therapy for my own knee injuries in the past, and even shoulder injuries and stuff. And so you think it's going to start one place, and it actually goes even back further. So a lot of times back injuries, we work on your abs too. You need to make sure that all those muscles in your core area are nice and strong and stable, so that then the next muscles down are safer, and then they can now build up.
So what's the most common, in sports medicine, what's the most common complaint you see from patients?
Typically knee or shoulder pains are the most common things I see.
Yeah.
And some of them, it's like yourself, people who are pretty active, who just keep going, and then end up pushing it just over their limit, and then they get an injury. Or it's somebody who's just now getting into stuff, not quite comfortable with it, and they just decide they're going to start running and stuff, and then they injure themselves while doing it.
In one of the past segments that we did today, Doctor, you mentioned like breaking a hip can be just detrimental to a person, especially an elderly person who, isn't used to not being mobile, and how it can affect their psyche and everything. How do you prevent, what's the biggest prevention for our older population?
Gotcha. So big prevention with regards to like injuries like that are devastating ones is an ounce of prevention makes a pound of cure. So with regards to finding some activity that you feel comfortable with and safe with, typically will help protect those joints, keep those muscles strong, keep those bones from being as brittle and slowing down. If people, and even women who develop things like osteoporosis, we still recommend you do some weight bearing exercises. Obviously you got to do it within reason, but doing those exercises does tell the body to keep protecting those bones as much as they can and keep strengthening them. Even if we go on a natural decline, it slows that decline down.
And a lot of that also goes back to what we discussed about nutrition, about movement, and about good sleep and de-stressing.
Unfortunately, it's all interconnected. It's hard. It's not easy choices sometimes, but they are the right choices a lot of times.
Yeah. So, all right. Well, Dr. Murray, we are running short on time. Is there anything else you want to tell the listeners about really just staying healthy by eating well and sleeping and all that as we age?
So I think there's a really good philosopher, Aristotle, who used to talk about what's called the golden mean: not too much, not too little. So if you're going to enjoy yourself and have fun with certain foods, or enjoy certain activities, or decide to take a break for a little while, getting back into exercise, you don't have to be extremely aggressive, but the goal is doing something that you enjoy doing is probably going to be more helpful than doing nothing or going right like way to a marathon training. You don't have to do that. Somewhere in between is totally reasonable and healthy for everybody to stay happy.
I love that. I love that. All right. So what's your contact information, Dr. Murray?
Gotcha. So our office here is 17501 North Del Mabry Highway. We're right in Lutz, Florida, 33548. My phone number in the office, 813-723-5452. And yeah.
I thank you so much. Thank you for taking time out of your day, talking about some, people, I think they know, oh, nutrition is super important. I need to keep moving. You know it, but to like actually get into it it's life-changing.
It can be real helpful. The hard part is sometimes, and I don't disparage anybody, but sometimes going to see your doctor or somebody else, they'll just kind of walk in and go, hey, you need to lose weight. And as true as that is, or hey, you need to be more active, sometimes it's not constructive. So the goal is finding constructive ways to keep that person happy and healthy. And if you have to talk a little longer and get into the weeds with somebody, I think that sometimes can make a big difference later on.
Well, thank you for that. Thank you very much. The conversation will continue next time on Medicare Connect Radio. We also know you have questions about Medicare enrollment. We have the answers. Learn the Medicare basics, discover the latest plan options, compare coverage, and enroll. Whether you're almost 65 or been covered for years, live your best life with Millennium Medicare Connect. You can go to yourmedicareconnect.com. Also, go to millenniumphysician.com and find a primary care physician near you. In good health, I'm Michelle McCormick. Have a great day.